So a lot of people come in and they ask us, what exactly is clinical nutrition? What's it for? How does it differ from, say like sports nutrition or physique, the nutrition that people use to get in shape, to get in competition shape, and things like that. And as a matter of fact, that's a great question, because I work with here in the town of Stockton, California. We work with various sports nutritionists. We work with a lot of athletes, a lot of the CrossFit community, a lot of the coaches. They come to us not so much for their sports nutrition needs, although they do consult with me because of my scientific and medical or health professional training in regards to that, but more so in the ways of handling various stressors on their body, the effects of stress on their body, and the effects of toxins on their system. Unfortunately, most people are largely unaware of how toxic their environment is. Here in the Central Valley, it's extremely polluted. We have a heavy agricultural base here. Some of it is organic farming. A lot of it is not, and so they still use a lot of chemical fertilizers. There's a lot of heavy metals in our environment here. Pesticides, herbicides, Roundup. Roundup is also known as glyphosate. It's one of the most toxic substances that we've ever created. It's extremely toxic. It's extremely pervasive when it gets into your system. It binds itself to your fat cells. And as you know, most people are running around in a not so ideal body weight. All of us have body fat. All of us have visceral fat, and that chemical binds into that. It leaches into it, and from there it leaches out into your body, and it wreaks havoc on your more vital systems, circulatory, endocrine, especially endocrine, and your detox systems, your liver and kidneys and lymphatic system. And so a lot of the things that people are coming in for in our office from a clinical nutrition standpoint, a lot of it has to do with detoxification, and then that ties into things like digestive issues, imbalances, a lot of hormonal imbalances. And that's really kind of the cornerstone of functional medicine, is dealing with these issues and optimizing those systems. So really what we do is we bridge the gap between standard medical, which is largely crisis care, and over here at this end you have fitness and optimal health. And we help to bridge that gap, that big space where a lot of people unfortunately fall into, and they don't want to wait until they get into crisis, although sometimes they do come in and they're in crisis and we have to pull them into this zone. I call it the yellow zone. This is the red-blue zone. Yellow zone, we get them into that, and then eventually we get them into the green zone, the optimal healthy zone. If they're in the yellow zone, we want to get them over into the green zone, and that's what a lot of our clients, especially our health industry clients, people in sports and health, that's what they come into us for. They want to be optimal. They want to stay optimally functional. They don't want to fall into this zone. This is not where they want to be, and probably nobody wants to be there. But unfortunately, due to either lack of knowledge or because of exposure to things that people are, they just don't know any better, or maybe lack of self-control, like people being addicted to certain foods. They get overexposed to certain things, they deplete themselves of nutrients, they come into us, we help them define what that is, we help them to deal with it. So anyway, I want to give you a little bit of that information in regards to clinical nutrition and functional medicine, and I want to thank you for watching our video today. Make it a great day.